Hey, thanks for clicking on the link. Welcome if it's your first time, and if you're a returning viewer, welcome back. I'm Debbie, and I talk about gadolinium deposition disease, gadolinium-based contrast agents. I'm not a doctor. I'm not giving medical advice. I'm not suggesting that you do or don't have imaging and use this toxic rare earth metal to see what's going on inside your body. That's your choice. It's a choice that I made without ever being afforded informed consent or an open dialogue or truth and transparency about the toxicity of this drug, wrapped in a ligand intended to make it safe, but new research shows it's not. And yet, we continue to inject this tens of millions of times annually because it's the best thing we have on the market. Is that the reason? I'm not sure. But I would say the risks may outweigh the benefits long term. I'm not here to make a decision for you or tell you what is right or wrong for you, but I am asking that you insist on informed consent, truth, and transparency in all things healthcare. Gadolinium is a toxic rare earth metal. The only way it's found in the human body at toxic levels is if the medical community injects it. The majority of people I meet every single month, 300 to 400 new people every single month, will tell you they were never given informed consent. Or they come to the group and they're desperate, looking for information. My doctor just prescribed this. I've heard terrible things, but no one will talk to me about it. No one in the medical community will talk to me about it. They just tell me I have to have it because it's what helps them see inside the body, what's going on inside the body. And that is a very accurate statement. But that's where the conversation ends. Very few doctors will extend the dialogue and talk about the toxicity of this rare earth metal that has problems, known to the point that the CDC released a statement that says even in small amounts may be associated with significant morbidity and mortality. That's a pretty bold statement. Gadolinium contrast-based agents, they've been used for decades. The first time it was recognized as a problem was with the disease known as NSF, nephrogenic systemic fibrosis. I think the first diagnosis was in 1997. Since then, new versions of the drug have been introduced. New ligands have been tried. The ligand is the wrapper that gets wrapped around the toxic rare earth metal to hopefully keep it safe while it's in the body. But now research says that's not likely, that there are problems that we don't understand. I'm here to say I'm a patient. I'm not a doctor. I'm not giving medical advice. I wasn't informed consent. No one gave me a consult, and I'm not alone. An informal poll showed 91% of the people would say the exact same thing I'm here telling you right now, that no one mentioned to them the risks of this toxic rare earth metal wrapped in a ligand that now the CDC says is problematic. Doctors don't know. Doctors are busy. They're so busy, they barely have time to chart for their patients. They see 30, 40 patients a day sometimes. They don't have time to read the research. I'm not even sure the research is shared with them. Or maybe it's put on a database and they're supposed to go out and log in and read. But who has time, right? We're in a crazy world. We live in a toxic world. Risks are expected. But if they're not talked about and they're not openly discussed, we have a bigger problem. The medical system is broken. Gadolinium is a comorbidity disease. A comorbidity disease because you're already chasing an ailment when you get in the MRI machine, and then they inject you with a toxic rare earth metal that's retained in your brain, your bones, your tissue, and your organs. That symptoms and side effects can show up days, months, weeks, years later. I was recently diagnosed with a heart condition. Shows that I have hardening. We call that fibrosis in gadolinium land. How they market hardening versus fibrosis, I'm not sure. Why we're not using consistent terminology, I don't know. But fibrosis is an end-stage game. It's an end-stage game because there aren't a lot of cures for fibrosis. A way to eradicate or eliminate or reduce the fibrosis that's set off in the human body. We know that heavy metals do that. We know that heavy metals are problematic. They're not intended to be found in the human body. We know that because we've studied years of cases related to mercury, aluminum, lead, arsenic. And we don't inject any of those metals directly into the bloodstream. Whether they're wrapped in a ligand or not, we do not inject toxic rare earth metals directly into the bloodstream as we do today with gadolinium-based contrast agents. They're problematic. 300 to 400 new members every single month coming to groups asking the question, what just happened to me? What did they inject me with? Why am I so sick? Why do I have new and worsening symptoms? New, unexpected, unexplainable new diagnoses that have nothing to do with the ailment I sought help for to begin with. That's not wellness. People, that's not wellness. Very few connect the dots because no one's having an open dialogue. And when you do try to open the dialogue and you do say to the doctor, well, could this heart fibrosis be related to the molecule called gadolinium that sets off chaos in the body? Fibrosis is an end game. It's not the beginning. Your body's been in chaos. It's fighting for itself. It's trying to find a way to stay in homeostasis, and it can't. It can't because the gadolinium molecule is the same size as calcium. It's finding a partner on the dance floor, and it's marching off or dancing off, and it's hiding in your brain, your bones, your tissue, and your organs. That's not healthcare. I don't care what you say. I will defend this. I've read thousands of hours of research papers, all ending in more research needed. We don't need more research. We need to reconcile the research we have. We need to make public the findings that exist and talk about those when you're sitting in a doctor's office. We need to come up with a new way to educate doctors, techs, patients about the ramifications of injecting a toxic rare earth metal. I'm not alone. Many don't talk about it. They're too sick. Many come to the group and don't know where to go from here. I don't know of any other drug that we don't talk about openly. I've seen multiple cardiologists in the last month. None of them want to talk about gadolinium. One said, well, your GFR looks fine on your blood work. And when I handed her the ultrasound report that showed there were problems with the kidneys, she must have known about gadolinium because she said, well, have you been diagnosed with NSF? And then shortly ended our conversation and our meeting. Gadolinium isn't inert. It sets off chaos in the body. And until we can understand the true ramifications it's creating and the chaos and the side effects and the symptoms and the syndromes and the diseases that it sets off, should we be injecting it tens of millions of times annually? It's not wellness. It's not healthcare. I speak about this every single day. I read research papers every single day. I try to connect the dots, figure out what's going wrong, how it's going awry. I'm not the only one. There's a growing community of patients who are doing the same thing. And now we see patients like Dahlia Smith, who's speaking publicly, injured by one drug, injected with gadolinium, and now questioning how are the two related, associated? What drug caused what problems? No one wants to talk about it. No one wants to talk about it. As a matter of fact, radiology community, they'll tell you risks are associated with everything. But what they won't tell you is, here's a copy of the medication guide. Sad, isn't it? This is our world. No one deserves to be sick all the time, every single day. New and worsening issues. Neuropathy, fibrosis, autoimmune diseases, MGUS, or mast cell activation syndrome, let's call it what it is. Autoimmune diseases. Parkinson's, Alzheimer's, those are associated with heavy metals. How many of those patients previously were injected with a gadolinium contrast agent that never connected the dots back? No one expects to get sick or sicker from a tool that's intended to be helpful. But to be helpful, we have to be transparent. We have to put all the factors out on the table and let the patients decide for themselves if the risks are worth it for them. May your journey be one of wellness always. I'm not a doctor. I'm not giving medical advice. I'm not even suggesting that you do or don't get an injection of a gadolinium-based contrast agent. I am concerned for people's health and wellness. I am a patient 7 years out who shows something is wrong with every organ in my body. It's a far cry from when I jumped in the machine, was injected with gadolinium contrast agent, only to suffer dementia-like symptoms and be sent back in the machine for a second injection to test me for Alzheimer's at the age of 56. I didn't have Alzheimer's, but my brain did, with additional testing, show that it was injured in 4 areas. I've made a huge comeback. But every comeback, new diagnoses, new diseases, new labels. Connect the dots. I don't know. No one will talk about it. Even the current situation with my heart, no one wants to talk about gadolinium. If we're not talking about it, we can't fix it. That's a problem. May your journey be one of wellness always. Thanks for joining. Take care.